CPR, child-infant. When normal breathing and heart function have stopped, CPR can give a life back. This section covers CPR skills for children ages 1 through the onset of puberty. At the end of the segment, there will be a demonstration of CPR for an infant. You will watch as skills are demonstrated and then have a chance to practice along with the video. During those practices, your instructor may give you individualized coaching to help you achieve the best results during practice. Please note that although barrier devices like gloves and face masks are always recommended, you won't see them here. Not only is it easier for you to practice without them, but it's also fine to give CPR in an emergency without them, as the risk of infection is very, very low. Let's get started. If you are not already seated next to a mannequin, sit down and get ready to learn skills that could save a life. Watch as this basic skill is demonstrated. You will practice it in a minute. The key reason for CPR is to circulate oxygen to the brain. It is essential to get the speed and force of the pumping right. To pump, our rescuer kneels next to the mannequin and places the heel of her hand in the center of the chest. Depending on the size of the child and the size of the rescuer, she will use one hand or two interlocked together to get the proper chest compression depth while pumping. She moves her shoulders directly over her hand with her arms straight. A child's chest should compress about 1/3 the depth of the chest, or about 2 inches. The rate of pumping is fast. It's equivalent to 100 to 120 compressions per minute. Let's listen to that rhythm. A full cycle of pumping is down and up 30 times. It helps to count out loud. Let's see a cycle.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Now, get ready to practice pumping along with the video. Kneel next to the mannequin, with your knees against the side of the chest. To pump, you'll use the heel of your hand. Place it on the center of the chest. Be careful not to press on the tip of the breastbone. Move your shoulder over your hand with your arm straight. Now, push down firmly with the heel of your hand. Remember, a child's chest should be compressed 1/3 the depth of the chest, which is about 2 inches. Avoid excessive compression depth. Let the chest come all the way back up by removing your weight from the chest. Your hand should remain in contact with the breastbone at all times. Avoid leaning on the chest between compressions. Pumping should move down and up smoothly. Don't jab. Get ready to do a 30 pump cycle in time with the on-screen rescuer. You should count out loud too. Ready? Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Don't be afraid to push hard and fast.
17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Sit back. Remember, pumping is fast and forceful, and when your shoulders are over the heel of your hand, you won't tire as quickly. You will get additional opportunities to practice pumping in this program. Rescue breathing is included for effective CPR. Relax and watch as our rescuer demonstrates rescue breathing. You'll practice it afterwards. First, she needs to open the airway, tilt the head, and lift the chin. Then, she pinches the nose and places her mouth around the child's mouth, creating a seal. She gives one breath, lasting about a second. She watches from the corner of her eye to confirm that the chest rises as air goes in. She releases the seal on the mouth and lets the airflow out, then quickly seals it again and gives another breath. This is done faster than you might imagine. Watch the demonstration again in real time. Now, get ready to practice breathing. Kneel next to the mannequin's head. Put the palm of one hand on the mannequin's forehead. With the fingers of the other hand, lift the chin and tilt the head back. This opens the throat to allow air to get into the lungs. Use the hand on top of the head to pinch the nose. Open your mouth wide and cover the mannequin's mouth completely with yours, pressing firmly to make a tight seal. Take a normal breath and blow air into the mouth. It's a quick breath of air with sufficient volume to make the chest rise. Remove your mouth from the mannequin. Take another breath yourself. Now breathe into the mouth again. Take your hands off the mannequin and sit back. This time, let's do it at the recommended pace for CPR. Tilt the head and lift the chin. Pinch the nose. Give breath. Give breath. Remove your hands from the mannequin and sit back. If you hear a hissing sound when you blow, air is leaking out from the nose or the mouth. Be certain the nose is pinched firmly, the chin is lifted, and there is a good seal around the mouth. If you don't see the chest rise during a breath, re-tilt the head and try again. If it still isn't rising, you'll need to check the airway and remove any object you see. You've got the basics of CPR. Now let's put them together, pumping the chest and rescue breathing. Kneel next to your mannequin and get ready to practice. Position your hand on the center of the chest. Move your shoulder over your hand with your arm straight. Ready? Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Keep your shoulder in position over the chest and push down hard with your arm straight.
22, 23, 24, 25, 26, 27, 28, 29, 30.
Tilt head, lift chin, pinch nose. Make a seal over the child's mouth with yours and breathe 1, breathe 2. Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9,
Press down
10,
smoothly.
11, 12,
Don't jab.
13, 14,
Let the chest
15,
come
16,
all the way back up.
17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Tilt, lift, pinch. Breathe 1, breathe 2. Okay, sit back and relax. On a real child, you would keep doing CPR until the person wakes up, an AED arrives and is ready to use, or emergency personnel take over. Now that you know the essentials of CPR, let's talk about when to do it. Watch while our rescuer demonstrates the steps to take before pumping and breathing. If she finds a child who looks unconscious, she must decide if CPR is needed. First, she checks for responsiveness. She taps and shouts.
Hey, are you okay?
At the same time, she is also noting whether the child is breathing or only gasping. A child with abnormal or absent breathing needs CPR. If there's no response and no breathing, she moves to the next step. Call for help. This is essential. If possible, our rescuer will direct someone else on the scene to call 911 and get an AED unit. She picks a specific person and gives explicit instructions.
Drew, call 911 and get the AED.
If no one is available to make the call and the victim is a child, do 5 cycles of CPR before pausing to make the call yourself. For the purposes of this video, we will only practice directing someone else to make the call. If an AED is available and ready to go, she will use it right away. If not, she starts CPR. Chest compressions are first. She opens the child's shirt and positions her hand to pump.
1, 2, 3, 4.
She continues CPR until the person wakes up, an AED is available and ready to use, or help arrives to take over. For now, let's practice the steps for when to do CPR. Put a shirt or jacket on the mannequin so you can practice exposing the chest. If you don't have one, just pretend to remove clothing from the chest. Sit next to your mannequin. If you find a child who looks unconscious, you need to find out if they are unresponsive. They could just be asleep. Tap the child on the shoulder and shout, "Are you okay?"
Hey, are you okay?
At the same time, note if they are breathing or only gasping. If the child does not respond and is not breathing, direct someone to call 911 or the local emergency number to get help on the way.
Drew, call 911 and get the AED.
Quickly get back to the child. If an AED is available and ready to use, then use it. If it's not, start CPR. Expose the chest so you can see where to place your hand. Make sure your knees are against the side of the chest. Place the heel of your hand on the center of the chest in contact with the breastbone. Before we add pumping, let's practice this again in real time. Sit back. Now, start the assessment.
Hey, are you okay?
Have someone call 911 and get an AED.
Drew, call 911 and get the AED.
Open the shirt and position your hand to pump. Okay, in the next section, we'll put this together with pumping and breathing. You're ready. You've practiced all the skills. Now we'll put them together. Let's do CPR. Sit next to your mannequin. When you see a child who looks unconscious, assess the child.
Hey, are you okay?
At the same time, note if they are breathing or only gasping. Direct someone to call 911.
Drew, call 911 and get the AED.
Expose the chest. With your knees against the chest, place your hand in position. Get ready. Pump.
1, 2, 3, 4.
Each
5,
pump
6,
should depress
7,
the chest
8,
about 2
9,
inches.
10,
Then let it
11,
rise
12,
all the way
13,
back up,
14,
but
15,
keep your hand in
16,
contact with the
17,
chest.
18, 19, 20, 21, 22, 23, 24,
Get ready to
25,
breathe.
26,
Each breath
27,
lasts
28,
1
29,
second.
30.
Give breaths. 1, 2. Arm straight. Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Give breaths. 1, 2. Ready? Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Breathe 1. Breathe 2. Position and pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Keep up the pace.
13, 14,
Count
15,
out loud.
16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Breathe. Pump.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
And breathe. Sit back. That was 5 cycles of pumping and breathing. Good work. When 2 or more rescuers are available, alternating rescuers prevents a decrease in the quality of compressions caused by rescuer fatigue. After 5 cycles, you may switch who is doing CPR.
3, 4, 5.
When doing CPR on an infant under the age of 1, there are a couple of key differences in how the skills are performed. Watch as our rescuer demonstrates CPR for infants. When she assesses the infant, instead of tapping and shouting, she stimulates the infant's foot to check for response. The response can be any vocal sound like crying or cooing or a body movement. At the same time, she assesses whether the infant is breathing. Once she determines that CPR is necessary, she exposes the chest, and instead of using the heel of her hand, she positions 2 fingers just below the nipple line. She pumps at the same rate as for children, but the depth is different. The compression is 1/3 the depth of the chest, or about 1.5 inches. After a cycle of compressions, she tilts the head back and covers the mouth and nose completely with her own mouth and gives 2 breaths, each lasting about 1 second. The volume of air is enough to make the chest rise. If you are alone with an infant or child who needs CPR, complete 5 cycles of pumping and breathing before calling for help.